Mental health reality versus expectations. A nursing perspective on ADHD and addiction recovery. Hello there. Welcome to Psych 4 All. Today, we're discussing a comprehensive journey from the nursing perspective, navigating the uncharted territories of ADHD and recovery from addiction. When it comes to mental health disorders such as attention deficit hyperactivity disorder, ADHD, the actuality is frequently not aligned with societal expectations. There exists a wide public misconceptions and stigmas related to mental health. These societal stigmas often create hindrances, making it challenging for individuals battling their inner difficulties to openly seek help and support. ADHD, a neurodevelopmental disorder, is typically characterized by persistent patterns of inattention, restlessness, and impulsive behavior. It's a common misunderstanding that ADHD primarily affects children only. Contrary, ADHD can and does affect people from all walks of life, regardless of their age, social status, or background. This condition does not discriminate. It can impact anyone, anywhere, at any stage of their life. It's essential to highlight a significant number of individuals with ADHD often find themselves stalked with the clutches of addiction. This co-occurrence of ADHD and addiction is not uncommon, further complicating the journey towards recovery. As nurses, we are entrusted with the pivotal role of aiding those who are battling both ADHD and addiction. Our mission is to empower these individuals, arming them with the necessary tools and knowledge needed to navigate their unique path towards recovery. This holistic approach allows us to address the complexity of their journey, acknowledging the interaction between ADHD and addiction, and providing them the tailored support they need. As nurses, we play a crucial role in supporting those struggling with ADHD and addiction. We provide education, medication management, and therapy to empower patients on their recovery journey. In addiction recovery, the reality is that it's not a linear path. This truth is critical to understanding the process of overcoming addiction. The journey of recovery is not a straight drive down a well-marked highway, but rather a winding country road with peaks and valleys. There will be days of incredible advancement, days of stagnancy, and sometimes days of setback. This is normal. It is almost expected. What matters in addiction recovery is progress, a forward momentum, however slight. It's not about achieving in one fell swoop, but about moving forward, bit by bit, step by step. This incremental progress, these tiny victories, they matter enormously. They build upon each other, forming the foundation of a recovery that's solid and lasting. Dedication and resilience are key. It takes a significant amount of courage, a deep-seated determination to face the shadows and confront them head-on. It's a journey fraught with hardship and struggle, but it's also a journey of self-discovery and growth. It's an opportunity to rediscover oneself, to rebuild one's life, brick by brick. Moreover, addiction recovery is not a solitary process. It requires the support of a caring community, a network of individuals who understand, empathize, and uplift. It necessitates a strong support system, whether that's family, friends, or a dedicated team of professionals. We encourage patients to explore healthy coping mechanisms, turning into activities and hobbies that bring them joy and peace. We advocate for self-care, nurturing the body and the mind, cultivating a sense of self-love and acceptance. Recovery is a journey, not a destination. It's a process of constant learning and unlearning, of growth and transformation. And together, we can face the challenges, overcome the obstacles, and emerge stronger. As we navigate the complexities of mental health, it's essential to recognize the interconnectedness of various factors influencing a person's well-being. Recognizing this interconnectedness is not merely an academic exercise, but a practical one, with tangible implications for how we approach mental health care from our nursing perspective. This perspective that we adopt is multifaceted, accommodating and understanding that mental health, like physical health, is shaped by a confluence of factors across our lives. Our nursing perspective emphasizes the importance addressing not only the symptoms, but also the underlying social, environmental, and genetic factors contributing to ADHD and addiction. This necessitates a holistic approach, which sees the individual as a participant surrounded within a network of relationships and environments, both physical and social, that impact their health. The social factors can encompass a broad range of elements from family relationships to socioeconomic status. The environmental factors could range from physical surroundings to exposure to certain toxins. Genetic factors are perhaps the most complex to understand, as they involve not just the physical makeup of the individual, but also how that makeup interacts with the person's environment and experiences. In the healthcare field, fostering empathy and understanding is crucial. This charge is not as simple as it sounds. Empathy is not just about feeling with someone, but also about understanding their perspective. Their understanding, on the other hand, requires us to confront and challenge our own biases and assumptions, and to educate ourselves on the complexities of mental health conditions like ADHD and addiction. We aim to dispel the myths surrounding ADHD and addiction, encouraging open conversations that promote compassion and support. The more we can educate and engage people in these conversations, the more we can break down the stigma and misunderstanding that often surrounds these issues. It's about fostering an environment where individuals feel comfortable sharing their experiences, asking questions, and seeking help. By sharing these stories, we hope to create a more inclusive and empathetic community where individuals feel empowered to seek help without judgment. This community is not just for those struggling with these issues, but for all of us. We all benefit from a more understanding, empathetic society that values mental health and recognizes the importance of comprehensive, compassionate care. Recovery is a collaborative effort, and it involves teamwork between healthcare professionals, patients, and their support networks. As nurses, we are the bridge connecting patients with the comprehensive care they need. Our profession isn't a job, it's a calling to serve, to heal, and to make a difference in the lives of those we touch. We are not just medical professionals. We are the lifeline between patients and their path to better health. We play a diverse range of roles. We are educators, equipping patients and their families with the knowledge they need to manage their health condition post-discharge. We are counselors, providing emotional support and reassurance in times of uncertainty. We are companions, standing with our patients through the highs and lows of their health journey. Our role extends beyond the clinical setting. It reaches into the heart and soul of the community. We strive to be advocates for mental health awareness, breaking down walls built by stigma and ignorance. We aim to challenge stereotypes that often surround mental illness, educating people about the reality of these conditions and the importance of seeking help. In conclusion, understanding the nuanced reality of mental health, particularly ADHD and addiction recovery, is crucial for effective nursing care. This insightful perspective sheds light on the challenges individuals face and emphasizes the importance of tailored support. As we continue into these topics, let's break the stigma and foster empathy for those on their journey to recovery. Join us in exploring diverse aspects of mental health on Psych4, all your go-to channel for comprehensive insights and compassionate discussions. Subscribe now to be part of a community dedicated to promoting mental well-being for all.